Hi everyone. Almost every student I have spoken with to date asked me a question: what did I like the most about my job when I just started working as a medical device sales representative? And what did I find the most challenging in my job when I just started? It's a fair question, and if you'd like to learn more, keep watching this video. Let's start with the biggest challenge. Well, before I continue, I'd like to say that different companies and different specialties may have different scenarios, and I will be talking about my personal experience. I started working as a medical representative for medical devices in neurosurgery and also in neurointerventional radiology. If you do not know what they are, I will have the link for you to go and study more if you're interested. Okay, let's start with the biggest challenge that I encountered when I started. It was the feeling of disconnection. I felt disconnected from the team, from the company I was working for, due to geographical conditions and also due to nature of the business. Many sales representatives, they work remotely, they do not go to the head office. They just cover certain territory defined in the contract, and they go to hospitals in that territory, which may make it a little bit isolated. And this is how I felt, especially at first when you do not have relationships with your customers either. So you're far away from the company and you also do not know many people that you are working with. Nevertheless, it took me a few months to overcome that, and I got used to it. And of course, I learned more about the team members in the company. I learned more and built relationships with my customers in hospitals, and started feeling more so as a member of the team on both sides, the company side and hospital side. What I liked the most about my job from the very beginning was the ability to spend time in surgical suite, in surgeries. I came to this industry from a medical side, and it was extremely interesting for me to be as close as possible to patients, to surgeries, and to devices that I was selling. And watching those devices being used in patients and saving patients' life are making me so happy and so fulfilled in my job. I loved it. On top of that, this job was not structured around regular 9 to 5 time schedule, which allowed me to develop my own schedule depending on needs of the hospital, of my customers, and my personal needs as a sales representative. I was able to create very efficient schedule and balance between spending my time in hospitals and clinics, which was about 80% of my time, where I would go to see surgeries, to talk to surgeons, talk to other healthcare professionals and discuss everything that's needed. And also about 20% of my time I was able to spend in my home office, where I would work on some reports, I would build business plans, I would have some product training, and just communication time with the company I was working for. That was a perfect balance with my own schedule, which I really enjoyed. To conclude this video, I would like to say that yes, at the beginning of this journey, I felt a bit lonesome at times, but having a benefit of being close to patients, being in surgical suites, seeing surgeries, as well as having my own schedule and being able to be in charge of that schedule, definitely neutralized that challenge that I faced at first. And of course, over time, all of that allowed me to learn so much from this career path. So if you are considering to become a medical sales professional, I hope this video was helpful for you. Please leave your comments and questions down below this video. I would love to hear your feedback. I would love to hear more questions. Tell me what else you would like to know, what else is interesting to you, and I will be happy to answer your questions and help you out. All the best with your career path, your job search, and subscribe to my YouTube channel, and I'll see you in my next video. Bye.